Think about someone maybe even a public figure who had radiation therapy, maybe years ago. And they seemed fine, right? Seemed to bounce right back.
Hmm.
But then imagine, like, years down the line, they start having this really difficult, painful, unexpected health problem. And it turns out it's actually linked back to that old treatment.
That's a really good way to put it. It happens. What seems like a completed chapter medically can sometimes, well, unfortunately, have these really long-term echoes for some people.
Exactly. And that's kind of what we're diving into today. We're going to explore these things called late radiation injuries.
Right.
Specifically, we want to look at damage to bone, that's called osteoradionecrosis, and also damage to other kinds of tissues, which they call soft tissue radionecrosis.
Yeah, ORRN and STRN are the terms sometimes used, but bone damage and soft tissue damage covers it.
And these things can pop up months or even like years after the radiation therapy is all done.
And it's so important, I think, to stress that this isn't the original illness returning. That's a common fear.
Oh, darling.
But this is actually damage to the healthy tissues caused by the radiation itself. It's a sort of delayed side effect.
Right, right. And look, medical stuff can feel super overwhelming, like learning a whole new language sometimes.
It certainly can.
So our mission today really is just to shed some light on one particular way doctors are trying to help manage these really challenging late injuries. We're going to talk about something called hyperbaric oxygen therapy.
Yeah, HBOT. It's a fascinating approach, and it can be quite beneficial in the right circumstances.
Okay, so let's back up a bit. These late radiation injuries, how long are we talking? You said months or years, but is there a typical time frame?
Well, it really varies. It could be 6 months, it could be 5 years, it could even be 10 or more years after the radiation treatment finished.
Wow.
A lot depends on, the dose of radiation they received initially, which part of the body was treated, and just individual factors, how someone's body responds.
And it's not just one thing, like you said. There's the bone damage, osteoradionecrosis, and then the soft tissue damage. Can you maybe paint a clearer picture? What does that mean for someone experiencing it?
Sure. Let's take the bone damage, osteoradionecrosis, first. Uh, Basically, radiation can really harm the tiny blood vessels that feed the bone.
Okay.
So without that good blood supply, the bone doesn't get enough oxygen, not enough nutrients. And over time, it can get weaker, it can break down, or it can become really susceptible to infection.
Where does that usually happen?
We often see it, probably most commonly in the jawbone, especially after radiation treatment for head and neck cancers.
Oh, wow. That sounds incredibly difficult to deal with. How would someone know? What are the signs?
Well, they might have ongoing pain in the jaw, maybe some swelling. They might find that if they have dental work done, like a tooth pulled, the area just doesn't heal properly. Sometimes you can even see exposed bone in the mouth.
Gosh. Okay, and then the other one, soft tissue radionecrosis. What kinds of problems does that cause?
So that affects the other tissues, skin, muscles, the connective tissues, sometimes internal organs too. And it's a similar underlying problem.
Damage to blood vessels again.
Exactly. Damaged small blood vessels mean less oxygen, which means healing is impaired. So this might show up as like a wound that just refuses to close up no matter what you do.
Even with standard wound care.
Even with standard wound care, yeah. Or you might see skin breaking down or just persistent inflammation and soreness in the area that was radiated.
So again, it's crucial. Not the original illness, but the healthy parts struggling years later because the radiation affected them too.
Precisely. It's a long-term consequence of the treatment itself, which, really underscores the need for treatments that can help manage these effects.
Which brings us neatly to hyperbaric oxygen therapy. HBOT, you called it.
That's right, HBOT. This is where things get quite interesting physiologically.
Okay, hyperbaric oxygen therapy. Sounds very high-tech. Layman's terms, what actually happens? What's the process like?
Okay, so picture either a special room or maybe like a big clear tube, almost like a pod.
Right.
The person goes inside this chamber. Then the air pressure inside is gradually increased, so it gets higher, significantly higher than the normal air pressure outside.
Okay, higher pressure.
And while they're in there, under that increased pressure, they breathe 100% pure oxygen, usually through a mask or a hood.
So pure oxygen, but under pressure. Why? What does the pressure do?
Well, think about a can of soda or a fizzy drink bottle.
Okay.
When it's sealed, it's under pressure, right? And there's a lot of carbon dioxide gas dissolved in the liquid.
Right.
As soon as you open it, release the pressure.
Fizz. The gas comes out.
Exactly. The gas escapes because the lower pressure can't hold as much dissolved gas. Hyperbaric oxygen works on a similar principle, but in reverse, and with oxygen. The increased pressure allows your blood plasma, the liquid part of your blood, to absorb much, much more oxygen than it normally could at regular air pressure.
I get it. The pressure forces more oxygen to dissolve into the blood. That's a great analogy with the soda.
Yeah, it helps illustrate the physics of it. So you're essentially supersaturating the body's fluids with oxygen.
Okay, so you've got all this extra oxygen floating around in the blood. How does that specifically help with that bone and soft tissue damage we talked about, the stuff caused by radiation?
Right, that's the whole point. Remember we said the core problem in these late radiation injuries is often damaged blood vessels leading to oxygen-starved tissues.
Yeah, lack of oxygen.
So HBOT directly counters that. By dramatically increasing the oxygen dissolved in the blood, it can reach those areas that are desperately lacking it, even if the blood vessel damage is significant.
Okay, that makes logical sense. Get more oxygen to the oxygen-starved place. But what does the oxygen do once it gets there? Does it just sort of sit there?
Oh no, it gets to work. It does several really important things. First, oxygen is absolutely vital for your body's own healing mechanisms. You need it to build new, tiny blood vessels.
Angiogenesis.
Angiogenesis, exactly, which helps restore blood flow over time. You also need oxygen for cells to repair damaged tissue, make collagen, and generally rebuild. There's lots of research showing that wound healing just works much better when tissue oxygen levels are higher.
So it's like giving the body's repair crews the fuel they need to do their job.
That's a good way to think about it, yes. Second, HBOT can help reduce swelling or edema in the tissues.
How does that work?
The high oxygen levels and the pressure itself actually can cause blood vessels in the swollen area to constrict slightly, which helps push out excess fluid. Less swelling means better blood flow, which again helps healing.
Okay, that makes sense too. Less swelling, better flow. What about specifically for the bone damage, the osteoradionecrosis?
For bone, that extra oxygen is particularly helpful because it stimulates the specific cells that are responsible for repairing bone and building new bone tissue. They're called osteoblasts and osteoclasts.
Yeah.
So in osteoradionecrosis, where the bone is weak and struggling to heal, HBOT can kind of kickstart those bone remodeling cells into action. We've seen, particularly with jaw osteoradionecrosis, that combining HBOT with surgery can really improve healing outcomes for some patients.
So it might help avoid really extensive surgery sometimes.
In some cases, yes. It can help prepare the tissue for surgery or improve healing after surgery, potentially reducing complications.
That's really encouraging. So it's promoting active rebuilding, not just stopping the damage.
That's the goal. And there's one more key thing, fighting infection.
Right, you mentioned infection risk earlier.
Yes, tissues that are damaged by radiation and poorly oxygenated are really vulnerable to infection. Certain types of our immune cells, neutrophils, need plenty of oxygen to effectively kill bacteria. There's actually a specific enzyme they use that requires oxygen.
Ah, okay.
So flooding the tissues with oxygen essentially supercharges these immune cells, making them better bacterial fighters. This is crucial because infection can be a major setback in these conditions.
Wow, okay. So it really does tackle the problem from multiple angles, doesn't it? More oxygen for basic healing, new blood vessels, reduced swelling, stimulating bone repair, and boosting the immune system against infection.
That's a pretty good summary of the proposed mechanisms, yes.
It sounds like a really powerful tool. Do we have good examples, like evidence that this actually works for people with these late radiation injuries?
Yes, there's definitely evidence supporting its use. For instance, it's been used for quite some time to treat things like radiation cystitis. That's inflammation of the bladder after radiation.
Okay.
And also for radiation proctitis, which is similar damage in the rectum. Studies and clinical experience have shown it can help reduce symptoms like bleeding and pain in those conditions.
And for the bone and soft tissue damage we're focusing on?
For osteoradionecrosis, especially the jaw, as we discussed, there are quite a few studies and reports showing positive results. Patients often experience less pain, better healing of exposed bone, and as we mentioned, it can be a valuable addition to surgical treatment. For soft tissue radionecrosis, it's used to help heal those stubborn, non-healing wounds, sometimes preparing tissue for skin grafts or other reconstructive surgery, or just reducing tissue breakdown and pain.
So it sounds like, while maybe not a cure-all for every single person, it's definitely a serious option that doctors have in their toolkit for these specific, difficult problems.
Exactly. It's considered a useful treatment for selected patients with these conditions. Research is always ongoing, of course, to refine protocols and understand who benefits most, but it has a definite role.
That's good to know. Now, you mentioned breathing pure oxygen under pressure. It sounds effective, but maybe a bit intense. Are there safety concerns people should think about?
That's a really important point. Safety is paramount, absolutely.
Uh,
And yes, HBOT is a medical procedure carried out under very strict supervision by trained professionals.
Like doctors and nurses who specialize in this.
Precisely. Hyperbaric physicians, specialized nurses, certified hyperbaric technicians, they all undergo specific training. There are rigorous safety protocols in place.
What kind of things do they have to watch out for?
Well, the most obvious one perhaps is fire risk. You've got a high oxygen environment.
Right, oxygen feeds fire.
Exactly. So there are extremely strict rules about what can go into the chamber. No electronics unless they're specially approved, no lighters, no flammable materials. Patients usually wear 100% cotton garments provided by the facility. They're told not to use oil-based lotions or hair products before treatment.
Makes total sense. Handle with extreme care. Any other risks besides fire?
The other main consideration is related to the pressure changes. It's called barotrauma.
Barotrauma, like a pressure injury.
Yes, just like when you fly in an airplane or go scuba diving. The pressure changes can affect air-filled spaces in your body, mostly your ears and sinuses.
Ah, that ear-popping feeling.
Exactly that. The staff carefully control how quickly the pressure changes, and they teach patients techniques to equalize the pressure in their ears, like yawning or swallowing. Most people manage fine, but it's something they monitor closely. Occasionally, it can affect lungs or teeth if someone has specific pre-existing issues, which is why a thorough medical evaluation is done beforehand.
So careful screening and teaching people how to manage the pressure changes.
Yes, and in the bigger chambers, the multiplace ones, there's always a trained attendant inside with the patients, monitoring them directly and able to help immediately if any issues arise.
Okay, that's reassuring. You mentioned different chambers. Single person, multiple people.
Yes, there are two main types. Monoplace chambers look like those clear tubes or pods I mentioned. They fit one person. The whole chamber is filled with 100% oxygen under pressure, and the person just breathes normally inside.
And
Then there are multiplace chambers, which are basically large rooms that can hold several patients, plus medical staff. In these, the chamber is pressurized with regular air, and everyone inside breathes pure oxygen through individual masks or hoods.
any advantage to one over the other?
Monoplace is often simpler for straightforward treatments. Multiplace allows staff to be inside, which is necessary if a patient needs more intensive monitoring or other care during the treatment session. The choice often depends on the facility and the patient's needs.
Got it. And how long does this usually go on for? Is it like 1 or 2 sessions?
Oh no, it's typically a course of treatment. For late radiation injuries, it often involves multiple sessions, maybe 20, 30, 40 sessions, or sometimes even more.
Wow, 40 sessions.
Yeah, it can be quite a commitment. Usually they're done once a day, 5 days a week. Each session itself might last around 90 minutes to 2 hours, including the time for gradual pressurization and depressurization.
That is a significant time commitment for someone.
It absolutely is. But, for someone dealing with chronic pain, non-healing wounds, or potential loss of function due to these radiation effects, the potential benefits improve healing, reduced pain, better quality of life can make that commitment very worthwhile.
Yeah, I can imagine. So thinking about our listeners, maybe someone listening knows a person going through this, or perhaps they're experiencing these kinds of late effects themselves. What's the main takeaway message about hyperbaric oxygen therapy?
I think the key things are, first, recognize that these late radiation injuries affecting bone and soft tissues are real. They're not imagined, and they can be incredibly debilitating.
Right. Validate the experience.
Absolutely.
Yeah.
Second, understand that hyperbaric oxygen therapy is a legitimate medical treatment option that specifically targets the underlying issue of poor oxygen supply in those damaged tissues.
It's not some fringe thing.
No, it's based on physiological principles. It aims to boost the body's natural healing by delivering that crucial oxygen, reducing swelling, helping bone repair, and fighting infection. It can be a really valuable tool.
So, maybe not a magic wand, but a scientifically grounded therapy that offers real hope and potential improvement for people stuck with these long-term consequences.
That's a very good way to put it. It's an important part of the toolkit for managing these complex problems, and it really shows how medicine keeps evolving to find ways to deal with the consequences, sometimes unintended, of other necessary treatments like radiation.
Well, this has been incredibly illuminating. Seriously, it's fascinating to think about something as basic as oxygen and how manipulating it with pressure can have such profound effects on healing deep inside the body. It really makes you stop and appreciate just how complex our bodies are and how interconnected everything is.
It really does. And it kind of sparks a thought, doesn't it? Like, how many other simple, fundamental things, elements like oxygen or physical principles like pressure, are being harnessed in medicine in ways we don't even realize?
That's a great point.
Maybe think about other ways gases or pressure are used. Anesthesia, ventilation, even things like the effects of high-altitude training for athletes. It makes you wonder what else is out there, or what might be discovered next using basic principles in clever ways.
That's a fantastic thought to leave our listeners with. So, if this conversation sparked your interest or if it feels relevant to you or someone you know, definitely do some more reading, but most importantly, talk to your doctor or healthcare provider.
Yes, individual assessment is key.
Absolutely. They're the only ones who can give personalized advice. Well, thank you so much for walking us through this. It's been a truly insightful deep dive into hyperbaric oxygen therapy and late radiation injuries.